So, you've made the decision to get bariatric surgery, and you're about to have your first consultation. But how do you make the most of your first appointment? I'm Dr. Barr, a bariatric surgeon in Dallas, Texas, and here are my top 10 questions I recommend you asking at your consultation to ensure that the surgery and the surgeon are the right fit for you. Number 1, am I a good candidate for bariatric surgery? This should be based on your BMI, your surgical history, and your current health conditions. 2, what type of bariatric surgery procedures do you offer, and which one is most suitable for me? If they're still doing older surgeries like bands or less than standard procedures with the words like mini in them, I would do further research. 3, if this is a general surgeon, ask how often they perform bariatric surgery and what type of structured program do they have in place for their patients. 4, what are the potential immediate risks and long-term complications associated with the surgery that you're going to get? 5, what impact do your medical problems have on the surgery, and how do those medical problems affect the risks both immediate and long-term? 6, how much weight can you realistically expect to lose after surgery? Having realistic and accurate expectations is huge for your success. 7, what testing will you need to undergo before surgery? This can be things like cardiac clearance, imaging studies, or whatever your insurance requires. 8, what will your recovery process look like, including diet restrictions, exercise guidelines, and follow-up appointments? 9, do they offer support groups or resources for their patients after surgery, and how do you join? And 10, do you qualify for insurance coverage for that procedure, and what is the estimated cost if you don't? Now, this last one usually is not really in the hands of the surgeon if it's for insurance, and we make our best guess based on the policy criteria, but usually this is something that isn't known at the first appointment, and we find this out once we submit for authorization for the surgery. Their cash pay price, though, they should pretty much have upfront. Above all else, remember to be open and honest at this appointment. We can't give you the best care unless we know the truth about what's going on with your health and in your life. And the right surgeon should be happy to answer all of your questions and happy that you've done your research. If you walk away from the appointment unsure about getting bariatric surgery, trust your gut. You may realize that you need to do more introspection on if you want surgery or not, or you might find that you want to find a different provider, and that's okay. This is a decision for your health, so take the time to make the right one. If you're in the DFW area and looking for a surgeon, you can follow the link in the bio and make an appointment with me at DFW Bariatrics. Otherwise, follow me for all things bariatric surgery, and if you have a question I haven't gotten to, drop it in the comments below.